This shows persons below poverty. It's sort of overlaid the poverty slide with late or no prenatal care for those women. And again, it's in those same. So the bigger the circle, the higher the concentration of those kinds of birth outcomes. Go ahead. And that's a risk factor for low birth weights. And again, you see when you overlay low birth weights, it's the same pattern in those same geographic communities. And ultimately, death to infants. Again, you can see that it's concentrated. There are these clear clusters and patterns. And that this slide further shows that the rate for infant deaths is much higher among African Americans than whites. But it's not just those sorts of health outcomes. Child maltreatment rates have the same kind of pattern, concentrated in the same census tract areas. Go ahead. Look at adults who's dying from heart disease. The same census tracts show the highest rates. Cancer, and this is among African Americans, so you can see the concentrations. So that's very similar to what you have in Alameda County. We don't have a boot. I don't know what our shape is, but it's not a boot. And this slide is years of potential life lost, a typical rate. And you can, if you look down on the left, bottom left, you can see that if you compare just the city, which is most of the red, to the suburbs, many more years of potential life, that is preventable things that have happened to folks that cause them to die prematurely occur in those same census tracts. Okay, so this is sort of the setup piece to what's coming is, all right, that's the bad news. We've got problems. We all know that. None of that's really news to anybody in this room. But what's being done about it? And this is actually the good side of the story. There's a great deal that you all are doing and others are involved in. And so I do not have time to go through all these, but what I wanted to show you was how many different initiatives, that is place-based initiatives, are actually going on today in Cuyahoga County, in the city, in the county, and even beyond the county into the region that is addressing many of those social determinants of health that Dr. Eisen talked about. So the good news is there's an awful lot of activity going on. And so when we talk about networking and what can we do and where do we go from here, there's a lot to build on. So I'm just going to run through these. I categorize them just go back one, in types of what the focus was. So we have a lot of programs focusing on the physical environment, the natural environment. So let's take a look. And I'll just let you read some of that. But you can see what the program name is on the left, what it's focused on in the middle, and then the name or names of the individuals who are the contact persons for those. And we can certainly make available the contact information for any of you who would like to link up. But you can see there's a lot going on. Watersheds, stormwaters, rivers and trails. There's just a lot of environmental justice. We talked about justice is an underlying issue. All right, when you look at the built environment, similarly, there's an awful lot that's already going on. Opportunity corridor, safe routes to school, the Cleveland 2010 Active Transportation Plan, and I'm not picking any out for any reason other than just to sort of draw your attention to some things. Food access, there's a number of programs that are focusing on improving people's access to food. Remember those slides about the grocery stores and the fast food restaurants. So there's a food policy coalition, Cleveland Cornerstone Project with CASE, a number of community gardening and local produce kinds of programs that are going on. Housing and vacant land. Again, there's just an awful lot that's being done. The city's 2020 citywide plan, reimagining more sustainable Cleveland, a significant effort that's been being conducted. Low interest loans, all sorts of land use planning activities and acquisition of vacant lands and foreclosed properties. Healthy homes to address the lead problem, weatherization, housing, rehabilitation loans, other lead programs, and healthy lifestyles. Steps to a Healthier Cleveland with their health department here. Cardiovascular health, that's the program that Martha referred to. Walk to schools. We talked about, somebody mentioned the walkable communities. Clevelanders in Motion, trying to get us all a little more active and moving. Senior safety. Obesity prevention programs. There's just a lot going on. And then others that I didn't know where to put, but there's the Cuyahoga Health Access Partnership that Sabrina and the folks at the county have been working on to get access to health care for the uninsured. There's the Health Equity Consortium. Peter Witt, he's here with Cleveland State, trying to educate folks about health equity and the issues that Dr. Eichen talked about. And a regional prosperity initiative. Obviously, we've got to have funds and a sustainable tax base in order to do the kinds of things that we need to do to address these problems. So, I ask you the question is, okay, what more is needed? We seem to be doing an awful lot. Yes, we do have significant problems and great disparities. Is there a critical mass? Well, you could probably argue there might be, yes, that there's a lot that's going on, there's a lot to build on, a lot to pull together. We can probably say yes to the critical mass. Do we need better coordination? Probably. Do we need a common vision, policy agenda, goals, measurable? Probably, yes. Probably need to move towards that. How are we going to pay for this? I don't know. Pooled resources, looking at ways to collectively fund things. Do we have the leadership we need? I think we do. I know there's a lot of leaders here, and it's a matter of all sort of pulling together. So I leave you with these kinds of questions just to think about as we go into a time of discussion about what can we do, how can we address these underlying, the root causes, these social determinants of health that involve all sorts of disciplines besides public health, planning and development and healthcare, all working together to try to address these things. That's clearly the way to do it, and I think Dr. Eichen has given us a bit of a roadmap that we ought to be able to figure out how to put the pieces together and move down the same kind of path that they're doing in Alameda County. So with that, I thank you.